Okay, hi everybody. So today we're going to be talking about cat scratch fever. So let's go ahead and get started. So cat scratch fever basically affects about 22,000 people a year, and it's caused by a bacteria called Bartonella henselae. Okay, and so what happens is people get Bartonella henselae. We'll go into it more in just a little bit. What's going to happen, Bartonella henselae is going to get into the human body. So let's talk about this really quick. So this is what's going to happen. Let's say we have a cat. Okay, and then this cat, and I can't draw. Okay, but this cat, let's say it has this bacteria in it. Okay, so it has the Bartonella henselae. So what's going to happen now is a flea is going to come, and I know fleas are smaller than cats. A flea is going to come and land on the cat, and it's going, when it bites the cat, the Bartonella henselae gets inside the flea. And then what it's going to do is it's going to start to reproduce and grow in numbers in the flea's digestive system. Well, eventually what's going to happen is this flea is going to have to go to the bathroom. So now it's going to go to the bathroom. Before I get there though, the Bartonella henselae, when it's inside the cat, is going to be inside red blood cells. So here's our red blood cell. And then what it's going to do is it's going to produce up to about eight other bacteria. Once it gets to about 8 other bacteria, what's going to happen is it's going to leave the red blood cell. Now, if a flea comes and bites, it's going to bring blood into the flea, and then that Bartonella henselae is going to start to reproduce in the flea's digestive system. Eventually, the flea is going to have to go and take a poop, right? So the flea is going to go poop. Then what's going to happen is this poop is going to irritate the cat's skin. So the cat is then going to scratch this, where this poop is, with the Bartonella henselae inside of it, and it's going to get underneath the cat's claws. Okay, so here it is underneath the cat's claws. We'll make the red represent the bacteria. So then, if the cat scratches somebody now, right, if the cat scratches somebody, now the bacteria is going to get inside the person. Two things are going to happen here. The first thing that's going to happen is the fact that where the scratch occurred, the person's going to form a papule. So let's just say this is an arm here, okay? And they form this papule there. So what's a papule? Papule is basically a solid raised bump. It's going to be made up of edema from swelling. It's going to be made up of any dead tissue that may be there. It's also going to be made up of white blood cells and things such as that. So we get this papule. But now what's going to happen is the Bartonella henselae is going to get into the bloodstream of the person. So here's the red blood cells again. So it's going to get inside the red blood cells of the person and start to travel. Eventually, and this is called bacteremia. So eventually what's going to happen is this is going to get over to the immune system, to the lymph nodes. And then what's going to happen is in the lymph nodes, when this Bartonella comes in, you have T cells and you have B cells. So this is my Bartonella henselae. And then you're going to have T cells and B cells inside here. So here's my T cell, here's my B cell. Well, because we have these and they've increased in numbers, we're going to start to increase the number of T cells in here also, and the number of B cells. So as these increase, what's going to happen is we are actually going to get an increase in the size of this lymph node. So the lymph node is going to become larger, and because we have an infection in the lymph node, we call this lymphadenopathy. And sometimes if you've ever been sick or anything, what may happen is you may actually feel like in your neck or something, you may actually feel the lymph nodes, or some people say it's swollen glands. That's actually the lymph nodes that become enlarged. They may become sore also. But like I said, we're going to call this lymphadenopathy. Now, normally, what happens is this goes away usually about 2 to 3 weeks. This is usually not a serious condition. However, occasionally it will go to the heart and cause endocarditis. It'll go to valves of the heart and cause endocarditis. But for the most part, this will go away in about 2 to 3 weeks. Sometimes antibiotics will be needed to make this go away. But for the most part, that's cat scratch fever. And thanks so much for watching. If you enjoyed the video, please hit the like and subscribe button, and we'll catch you next time.